Hi there, I'm Alex, Senior Clinical Advisor at Carepatron, and welcome to this explainer video on our medication reconciliation form. Before we get into the form, you might be wondering, what is a medication reconciliation? Medication reconciliation refers to the process of making the most accurate possible list of medications for a patient. Patients may need a medical reconciliation following transfer of care between practitioners, providers, or services, as these are the riskiest times for mistakes to be made. Having an accurate knowledge of a patient's current medications is an integral part of every medical treatment or procedure, so a medication reconciliation is a very important process for your patient's care. Start by downloading the PDF or accessing the template from within Carepatron. See the end of the video for how to do this. Once you have the form open, there are several sections to complete, so let's run through them now. First, fill in your patient's information, including any known allergies and reactions. As you are obtaining the best possible medication history, check off the various sources you use. Input the best possible medication history, and fill out each column as you go. See our example template for what this might look like when it's finished. Once you've finished the best possible medication history, take all of the medications with the actions continue or start and copy them into the reconciled medication list with the correct dosage, route, and frequency as determined by your team. Finally, don't forget to sign both the medication history and the reconciled medication list. Here we can see the first page of our example medication reconciliation form to help you get a better idea of how to fill out this form. Here the patient had a few medications she was taking, but some discrepancies were found. A decision was made to stop 2 blood pressure medications and start 2 new ones. An additional discrepancy was found with the dosage for acetaminophen, so the old dosage was stopped and the new dosage started. The medications with start or continue were then transferred to the reconciled medication list with the correct dosages and frequencies. You can also add any additional comments here if you need to clarify any points. To access this template from within Carepatron, select your patient from your client list. Then click Create Note. To select a template for your note, hover over this button and click See Template Library. Ensure you're filtering by community templates to see the full range of Carepatron's templates. Search by keyword, click the result you want to use, and here it is. Within the Draft tab, you can edit and fill it out as you need. When you're done, hit Publish.